Have you ever wondered if you could feel drunk without actually taking a sip of alcohol? Imagine experiencing the signs of intoxication while you swear that you have not taken any alcohol. So today we'll be diving into a rare medical condition known as Brewery Syndrome, where your own body becomes a brewery, fermenting alcohol internally. Brewery Syndrome is a rare condition where the body produces alcohol internally due to the fermentation process by certain fungi or bacteria in the digestive system, mouth, or urinary system. People with this syndrome may show signs of being drunk even if they haven't consumed alcohol, and they often mention having a diet rich in sugars and carbohydrates. Sometimes our bodies naturally make a tiny bit of alcohol during normal digestion. But if certain yeast or bacteria go out of control, they can produce a lot more, leading to really high blood alcohol levels. Brewery syndrome is more common in people with health issues like diabetes, obesity, and Crohn's disease, but it can also happen to otherwise healthy people. There are specific types of yeast and rare bacteria that can cause this. It's not often diagnosed, and it might be even less recognized than we think. In extremely rare cases, there have been instances of this syndrome in the mouth and bladder. Certain friendly yeast from Candida and Saccharomyces families can turn troublesome and cause Brewery syndrome. Some bacteria like Klebsiella pneumonia, Enterococcus faecium, and Citrobacter are also linked to this condition. People with existing health problems like diabetes or liver issues might have a harder time getting diagnosed with Brewery syndrome. In one study, those with type 2 diabetes or liver cirrhosis showed higher levels of naturally produced ethanol compared to those without these conditions. The highest levels were found in people with both diabetes and cirrhosis. A study mixing common yeast found in infant formulas like Candida albicans and Saccharomyces cerevisiae showed they can produce ethanol, which could be a clue to why some people develop Brewery syndrome. The production of ethanol by bacteria is connected to the development of non-alcoholic fatty liver disease. Higher ethanol levels are also seen in obese individuals and those with non-alcoholic steatohepatitis. The main problem leading to Brewery syndrome is when certain fermenting microbes take over in the gut, mouth, or urinary system. This happens when the balance of good bacteria is disrupted, often due to a diet high in carbs and processed foods, as well as excessive use of antibiotics and other medications in food and medicine. There are other factors that contribute to this syndrome. Number one is Brewery syndrome has been seen in people with conditions like short bowel syndrome, pseudo-obstruction, or small intestinal bacterial overgrowth, showing signs of alcohol intoxication. A study comparing people with Brewery syndrome to those without found that those with the syndrome tended to have poorer overall health, more food sensitivities, and used antibiotics for a longer time. They also reported issues like bad breath, diarrhea, and changes in bowel habits. Another study comparing people with Brewery syndrome to a larger group of participants showed that those with the syndrome and their household members were more likely to own a pet, get less sleep, and have lower quality bowel movements. They also drank more water, consumed less alcohol, ate at home more often, and had a higher presence of non-food allergies. Measurements of natural ethanol in some individuals with brewery syndrome showed high levels, especially after eating a diet rich in carbs. Stress and skipping meals can make these levels even higher. There might be a genetic factor involved, as some people have a genetic variation that reduces the activity of enzymes responsible for breaking down ethanol in the liver. This could explain why some ethnic groups may produce or clear ethanol differently, but this has not been specifically studied in brewery syndrome patients. Brewery syndrome can have serious impacts on person's life. It leads to issues like vomiting, belching, chronic fatigue syndrome, dizziness, coordination problems, confusion, headaches, and irritable bowel symptoms. Chronic fatigue syndrome can also bring about mental health problems like anxiety and depression, affecting a person's overall well-being and productivity. One tricky aspect is that due to the high alcohol levels produced internally, individuals might test positive for drunk driving even if they haven't consumed any alcohol. Just imagine explaining to the police that you have not taken any alcohol. The unpredictability of when these episodes of intoxication happen can cause problems such as false legal issues from driving citations and strain on relationships. Because this condition is not well known, doctors find it challenging to diagnose and treat. A thorough examination, including a detailed look at the person's diet and information from family members, is crucial since patients may not remember what they ate before an episode of intoxication. A well-coordinated treatment plan for brewery syndrome should involve the patient's input to ensure they follow the treatment. If the person has an extremely high blood alcohol level, they need urgent treatment for acute alcohol poisoning to stabilize their condition. Drug therapy can be used based on the specific yeast or bacteria identified. Prescribe drugs considering the culture and sensitivity results. Most patients need a course of azoles or pollines. Rare or resistant microbes might require different medications like echinocandins or antibiotics. On diet therapy, a crucial part of treating brewery syndrome is modifying the diet to include high protein and low carbohydrates until symptoms improve. Since sugar is turned into alcohol, avoiding simple and complex sugars help reduce the alcohol produced in the digestive and urinary systems. Supplements can also be used. Using multi-strain probiotic supplements can help balance bacteria in the digestive tract, but their effectiveness in treating brewery syndrome still needs more study. To reduce the risk of recurrence of brewery syndrome, it's important to stay away from carbohydrates. In managing the disease, a nutritionist should be involved. Anything that upsets the balance between harmful and helpful bacteria in the gut can potentially increase fermentation. Antibiotics should be avoided if possible. If antibiotics are necessary, there should be a plan to retest for fermenting pathogens and treat if needed. Various approaches like controlling dietary carbohydrates, using antifungal or antibiotic therapy, avoiding antibiotics when possible, and taking probiotics have all been reported as successful treatments, either alone or in combination. For those with persistent and chronic relapses, fecal microbiota transplants which is the process of transferring fecal bacteria and other microbes from a healthy person into another person, might be considered. So it's clear that our bodies can sometimes surprise us in the most unexpected ways. So if you found this information interesting, don't forget to hit the like button, share with your friends, and subscribe for more mind-blowing health topics. Thanks for watching.